We have a presentation by Community Police Alliance Program, Mr. Dameon Stackhouse, who, as I mentioned earlier, is a licensed social worker. And we invested in this program quite some time ago, and it came to be or active in September of 2021. And the floor is yours, Mr. Stackhouse, our Community Police Alliance Coordinator.
Thank you, Director Robinson, Deputy Director Morano, Commissioners, County Council Administrator, and clerk of the board for just having me here right now to just bring you up to date on what's going on. After the murder of George Floyd, my son had a dream that he was shot by the police. And I said to myself as a father, I need to do something to let him know that he's going to be okay. So I contacted Chief Payne, the chief of Somerville, and organized the first protest or march on Juneteenth. During that time, I got an opportunity to start meeting Chief Payne and the captains, building a relationship. We went to a training together for the police chaplaincies, me and Jamel Pittman, one of the organizers. And we started building a relationship to start bridging this gap with the community. I did something and I had an event and they came out and they shared with me and we took pictures. When my hometown was dedicated 100 years old, they came out and they took pictures and they were there to support. And when this position opened, Captain O'Neill emailed me and said, I think you'd be perfect for this position. Fill out the application and go through the process. I say that because with everything that's going on in Bridgewater right now, we have begun the work. We started this almost 2 years ago to bridge that gap. And I know and I trust that everything is going to continue to move forward, that things are going to get better. And I wanted to share that with you so that you understand that this is very important, that we build those bridges and we work together and you start it early. You don't wait till things happen and then you start doing the work. We've already started the work. So we're going to go to the first slide of the presentation. This is a long mission statement because there is a lot of things that we do. The Community Police Alliance Coordinator's mission is to bridge the gap between the community and law enforcement and respond to mental health crises with the Bridgewater Police Department when called upon. The CPAC will receive, analyze, and follow up on referrals provided by the Bridgewater Police Department based on their observations. CPAC will offer referrals to individuals and families for information to support their needs and their advantages, to take advantage of the community services that address issues such as mental health, substance use, domestic violence, housing, food insecurities, child care, health care. The main focus of the CPAC is to reduce the harm to the public, saving law enforcement resources, and creating a better community for everybody. Next slide. So how do we do this? There is a layer of support that I work with. Mike Frost, every day we talk about what's going on. Chief Payne, every day we talk about what we're going to do and how we're going to do it. I talk with the mental health administrator and our addiction services, and I call Dr. Celeste, and we talk about different things that are going on with trainings and what I need to read to build my knowledge of how I help the police department better understand whatever's going on, because there's a lot of things that legislation that's been passed and directives from the AG that they might not have heard about or just need to be reminded because this is what's going on. Next slide. How does it work? If there's an emergency response, cell phone is never off. I get called, I get text. If I'm on the site, I'll respond directly to whatever is going on, whether it be a mental health crisis, substance use, overdose, whatever it may be. If there's not that call, there's referrals. So a report will come to me. I'll go through the report. I'll call and contact the residents, or if they want me to, I'll visit them and we'll go through different things. And then it's the basic follow-up and follow-up and follow-up, because you need to be involved with what's going on. And you can't just one time call someone and think that it's over. You need to continue to check on how they're doing, check to make sure that they're calling the individuals for the resources that they're supposed to be provided through the county. Next slide, please. So our current focuses are everything that we listed in the mission, and then others. You know, there are things that are going to pop up that aren't on here, but it's all a part of social work. So other is there. We will continue to focus on these issues, and we will work with the community in them. So the connections that we've already made and we're going to continue to make is with PES, Safe and Sound, Human Services, the county jail. I just left the county jail before I came here. That's why I was a little bit late, because I went to go visit someone. They were about to be released. I knew that they needed to get into rehab. I took them to rehab as soon as they were released, because I had been working with this individual to get them to say, I'm ready to go. And when they got locked up and I found out, I called Captain Moy. I asked him, can I come in to see, which is one of the building the relationships. How do we get this done? He said, come in at 2:30. I went in at 2:30, had the booth visit, talked to them, found out, okay, they can be released. And being released isn't enough. You're suffering from opioid use disorder and they release you. You're already kicking. You're going through withdrawals. What are you going to do if somebody doesn't take you directly to a rehab at that moment? So that's where I just came from. And that's one of the resources in the connection that we have built. The food bank, families are in need. Go get some food for them. Take it to them. Please. And we're involved in a lot of different councils just to support, see what's going on. Mental Health Board, the Bridgewater Municipal Alliance, sitting in on their meetings, giving them some advice and just talking. And the school. So we have an Educational Service Commission. And the next slide, I go there at least once or twice a week, sometimes more if needed. And I share my story with these kids. These kids have gone through things that a lot of us will never experience. And because of my background and because of my story, they relate. I can talk to them. It helps. I built a relationship with the principal there, Dr. R. And we're working with these kids to make sure that they have a future. In the next couple of months, because we have the relationship with the food drive, the food bank, we're going to do a food drive. Get these kids involved in what it's like to be in that voluntary, that space where you're volunteering to do things and you're learning how to help others. So in the future, in the next couple of months, we'll have that. So I have been doing everything that you can imagine at this police department. Roll calls have really led to the opening up of some officers that might have been skeptical of me being there. But they will stop in and we'll talk and share each other's experiences and learn. I've gone through the ICAT training. I've gone through the ABLE training. I have gotten a better perspective of what they're going through every single day, the hypervigilance that they might be experiencing on a day-to-day basis. This is how you build the relationship. Learn and understand what they're going through so that you can actually support them. That's what this is. This is a support to make sure that we're all on the same page and we're all protecting and doing the best for our communities. Slide. I've gone to the State Troopers Citizens Academy, 10-week program, built relationships with our state troopers where, over the last week, at least 3 or 4 state troopers have called me and asked me if I'm okay. And do I need any assistance? And I've used and passed that along to Chief Payne, and he's, contacted them, and we're just all in conversation because these are the things that we need to do. As you see, we have 49 referrals listed here. That number has changed by about 4 or 5 since the PowerPoint was made. We're up another 4 or 5 referrals. And it's a wonderful thing when you can continue to work with individuals. I'm going to talk briefly about a couple of the referrals that I received. And the one that's on the next slide, I'm probably not even going to talk about. We can go to the next one. Yeah. I'm not even going to talk about this case, just because if you want, you can read it. I'm going to talk about one of the cases that changed one of the officers' opinion of me. Officer came to me and he said, "Hey, I got this referral I want to give you. This individual is really going through a tough time. She went through a traumatic event and constantly drinking, and I'm worried about her. Here's the case. Would you follow up?" Now, when it was handed to me, he didn't really trust me as much as he does right now and didn't understand why I was here. But like we started at the beginning, it's follow up, follow up, follow up. So I called, no answer. I called, no answer. I called her sister, talked to her sister, got another number. Each time I did this, when I seen this officer, I let him know, hey, this is what's going on. I gave him an update. A couple of weeks ago, I called. Dameon, I need to go. I'm ready. Thank you. I called mental health administrator, our addiction services coordinator, and we get her into a rehab within two hours. That's what it's about. And when I told this officer that we did that, he broke down and was like, thank you. You don't know how much it means to me to know that somebody's actually doing the follow-up and care. And I didn't think that that would be you. Because of my background, I didn't think that it would be you. And now I know that you're here and you care, and I really want to work with you. That's what this is doing. And the next slide is a really personal one for me. So as you read it, it's in loving memory of Mr. Edward Tupac Hall. So if you're from this area, you know there was a shopping cart of clothes over in the circle of Findern for a while. This individual was homeless. And one of my first referrals from Bridgewater was find Mr. Hall, talk to him, see if we can get him into some housing. For about 2 months, I looked for him, drive around, looking. Officers would look for him. Nobody was seeing him, couldn't find him. My relationship with the county jail, I went to go see someone. I got another referral. I was going to see somebody on this day, and I went in. The middle of December was when Code Blue was at its peak, like around December 9th. And I'm walking into the county jail, and this individual has like 3 bags, and he's being released, so he's out with 3 bags. And I'm looking, I'm like, that's not normal. You don't get locked up with that much stuff unless you're homeless. So I stop and I say, hey, you all right? He's like, yeah. I said, where you going? He said, I'm homeless. I said, okay. Well, what's your name? He said, Tupac. I said, what's your real name? He said, Edward Hall. We started making things happen, and we got him into one of the motels that we use as the county to help. Got him an Uber, got him there. 2 hours. I went back and forth working with him. Within 2 weeks, we got him into an apartment in Bound Brook through emergency housing. I went to go see him on February 1st. So the money that goes into it had built up a little. So he had some money on some cards, and he wanted to go to Walmart. I said, all right, well, I'll be able to come by. We'll figure out something. We'll talk about it, and we'll get you to Walmart so that you can get the things that you want for your place. The next day, he decided he was going to just walk from Bound Brook to the Walmart in Manville. And right before that bridge, he was hit by a car and tragically killed. On Saturday, I went to his funeral, and I shared with his family because he touched me deep. As we continue to move forward, we have to understand that we have to be involved with everybody that were referred. We have to build those relationships with the community so that it works. His brother is another brother to me now. We will continue to talk. I will talk to him and make sure that he's okay. He'll call me and make sure that I'm okay, because this hurts. It hurts that we work to help someone and then feel like it was for nothing, even though we know everything works for the good. I share that because I want you to look forward into the future and how we do this all over Somerset County, and how we make this the model in New Jersey. So I thank you for letting me share, and I appreciate you for allowing me to be in this position.
Any comments or questions from the commissioners? We thank you. As we move forward as a community, and that community collective means law enforcement, government, social services, human services, the residents, all working together, as you put it, for the good, for the betterment of the people who work, live, and play here in Somerset County. So thank you for the work that you do, and allowing us to have an opportunity to make it possible for you to do that work, and for the community to be beneficiaries of that work.
Look, it's hot. It's hot. Good.
Thank you, Dameon. No, just a thank you from myself too. It sounds like you're really connecting and jumped in right with 2 feet right into the deep end of the pool and just got to work. So that's really impressive. Right now, you're limited to Bridgewater residents right now.
Yes.
Currently, right?
But our resources, they stretch across the county. So anybody that needs something doesn't necessarily me, but my referrals are coming directly from Bridgewater.
Okay, very good. God's work. Thank you so much.
You're welcome.